Okay, Dr. McAllister is going to join us now. We're going to talk about chronic headaches. Good morning. How are you?
Good morning, Ron. I'm fine. How are you doing?
Great, thank you. What part of the country are you in?
Just down the road from you in Connecticut.
Oh, wow. Well, come on over.
Actually, I was just there. The International Headache Society was just in Boston back in June, and we all had a great time.
Well, okay. Kind of seems a little weird to say I had a great time in a headache thing, but okay. How chronic? I mean, I've heard of migraines and such, but how prevalent are chronic headaches?
So, most of us have had a headache in our lives, and that's really not what we're talking about. We're talking about 36 million Americans suffer from migraine. So that's a neurological brain condition. That's throbbing and light and sound sensitivity and pain and nausea and really inability to get up and get to work or take care of the kids. Of that group, there's a subset, about 3.2 million Americans, still a good number, that have chronic migraine, and that's 15 or more headache days per month, every month, lasting more than 4 hours, of which half have those migraine features like the throbbing and the nausea. So this is a really debilitated group of folks.
Wow. What causes migraine? Is it neurological?
It's definitely neurological. It's a brain disorder, much like asthma is a lung disorder. It's strongly genetic, so you can often turn to mom or dad above you and see which one of them had bad headaches. And there are also a number of triggers that can get the ball rolling, such as hormonal cycles, lack of sleep, depression, lack of exercise, certain foods, not drinking enough water, too much caffeine. So all of these can trigger someone who's genetically wired for this.
I see. And I assume that there's no real treatment as far as getting rid of. You might be able to lower the symptoms here and there, but the actual condition itself not.
Right. So just like high blood pressure and diabetes, migraine is a chronic condition, but there certainly is treatment. So for regular migraine, we have a whole set of good treatments, including a lot of lifestyle changes. For chronic migraine, there's one drug approved, and that was in October 2010. The FDA approved Botox for the treatment of chronic migraine. Yeah.
Interesting. How does that work? How does that physically work?
So it's injected. It's a little tiny needle injected under the skin in 31 muscles and 7 sites around the head, the neck, and the shoulders. And in 2 very large studies of over 1,300 participants, what we saw, and I was one of the investigators in that study, what we saw is a pretty nice decrease in the number of headache days, about decrease of 9 headache days, and about 40 hours of decreased headache in this group who's suffering greatly. So we were very excited when in 2010 the FDA approved this, and now it's available as a treatment option for chronic migraine.
And also, your face probably looks real good.
My patients are really concerned about getting their lives back in order. But
I'm just saying that why not?
If someone notices that, right? Not all side effects are bad. So I agree with you.
All right, fine. I mean, incredibly debilitating. I assume, and I mean, it's nice that that's come about, and also that there are conventions such as what you attended in order to keep up on the technology of medical technology. How can people get more information if they know somebody that suffers or perhaps themselves?
Yeah, it's a great question. 80% of people who have chronic migraine don't even know they have it. So it's really important. A lot of folks are trying to treat, 4 headaches a week on their own, and they're trying to go over the counter and take any sort of tablets and ice in their head and all that. So the important thing is if you're having lots of recurrent headaches, particularly those in which you have to miss work, don't suffer alone. Seek out a neurologist, headache specialist, and then there's a really dynamite website I'd like to tell you about called BotoxChronicMigraine.com. And it's a wealth of information on migraine, chronic migraine, the use of Botox, and you could even put your zip code in and find a headache expert who can possibly inject the Botox if that's right for you.
Is this something that would come on with age a little bit, or something that you would start suffering with as a child? I mean, what if all of a sudden this started happening at the age of 30, would that be considered to be this particular situation?
Sure. I mean, I've got
Really?
kids in my practice as low as 4 or 5 years old. I have a 93-year-old nun who I still take care of for chronic migraine. But sure, the 20s and 30s are a very common time for this to begin.
So, I mean, how about someone who's like in their 50s and all of a sudden they get these chronic headaches? Is that likely?
It's less likely, but certainly not uncommon. What I would do as a headache specialist, if someone came to me and they were 56 years old with new onset everyday headaches, they might get a further workup. They might get a scan of their head and some blood tests, etc.
I wonder why this came on suddenly like that. Okay.
Exactly.
Okay. One more time, that website, please.
The website is BotoxChronicMigraine.com.
Excellent. And I always make the point, doctor, that if there's, you have to be in command of your medical situation. You can't wait for a doctor to ask you questions. If you have a concern, you approach your doctor and you seek out the proper route. People need to take control of their own bodies sometimes.
That's the kind of patients I like in my practice. Educated healthcare consumers, you bet.
Perfect. Well, thanks to listening to people like yourself, we become educated. So thank you for your time this morning.
Thank you, Ron. Take care.
Take care. Bye-bye.